As COVID-19 cases continue to rise across Ontario, the province's top doctor has announced a pause is being put on further reopening plans indefinitely.
Earlier today, the government announced that it will be extending its pause of the lifting of capacity limits in remaining high-risk settings where proof of vaccination is required. This includes food or drink establishments with dance facilities such as nightclubs and wedding receptions, in meeting or event spaces where there is dancing, strip clubs, sex clubs, and bathhouses. We must remain cautious in the face of the virus, and this pause will allow us to continue monitoring trends in public health and healthcare indicators, while also learning more about the Omicron variant.
Adding more restrictions is off the table, at least for now, but the new year brings an uncertain future to a province which is now reporting over 1,000 new daily infections, a number which hasn't been seen since May. The province was looking at getting rid of vaccine passports come January, a decision they still plan to review in a few weeks' time, but admits it doesn't seem likely. They also plan to do away with mask mandates by the spring, another decision which even the thought of has come with backlash.
We made a staged plan for January, February, and March, and it was to always review data, and we will review the data in the mid of January and make recommendations to government. But I can tell you we're meeting regularly with government and making ongoing recommendations to protect the health of Ontarians. One of them is the verification certification process, which I think has done us well in Ontario, protecting our businesses, keeping them open, and minimizing spread in those environments. I think it has proven its usefulness, but if there is a decrease in risk, we could make the recommendation to leave it up to the private business.
Dr. Moore says they don't want the fully vaccinated to interact with the unvaccinated, a situation which could make COVID-19 case counts rise even more. That is why loosening of restrictions seems unlikely. The concern now is with schools, a setting where outbreaks are starting to get out of control. While some top doctors are already calling for their closures, Dr. Moore says they aren't prepared to do that just yet. Days before the winter break begins, each child will go home with 5 rapid tests, which they can use over the 2.5 weeks. Participation is voluntary, but the hope is this could pick up infections, which would otherwise go unnoticed.
We are very much aware of the Science Table's review of rapid antigen testing and have had rapid antigen testing as a tool in school increased activities to keep them open, which is our goal as public health physicians and as educators. The target is to provide surveillance testing in schools if and when necessary, but also to testing for stay and play, as well as increased screening testing as we're having over the holidays. So it is a robust strategy that is rolling out in the coming months. We knew we'd need them as the risk increases heading into the winter, and you'll see increased availability of testing.
Tomorrow, Ontario's top doctor, Kieran Moore, will hold a press conference to discuss any possible further restrictions that will be coming to the province of Ontario to try and get a grip on this growing COVID-19 pandemic. Now, sources have said that everything is on the table, from closing down schools for a few weeks to going back to phase 3 in the province's reopening plan. Now, we are being told none of that is expected, at least for now, but instead the province is looking to make some changes to the proof of vaccination program, which will force you to use a QR code instead of a paper copy. Charlie Santuan News, Ottawa.